Hello friends, I welcome you all to Nyandeep Academy for UPSC and MPSC. Here we are going to discuss, analyze and also study some vocabulary that is based on the Hindu editorial dated 11th January 2021. So let's begin with the first article. The first article is titled Gearing Up. We will read the article line by line and word by word, but before that, we will see the vocabulary. We'll discuss the important words that are there in this. The first one is bolster, which is a verb which means support or strength. The second word is comorbidities, which is a noun. It means more than one illness or disease in one person at the same time. Comorbidity. The next word is efficacy, which is a noun and it means the ability to produce a desired or intended result. The next word is dire, which is an adjective and it means extremely serious or urgent. The next word is placebo. It is a noun which means a substance that is used for controlling and testing new drugs. So that is about the vocabulary. Let's read the article. Is gearing up. The meaning of the word gearing up is means preparing, is getting ready for something. So as India starts on vaccination, the government must bolster public trust in the process. Now, I'm sure all of you are aware that India is in the stage wherein we are preparing the entire country to receive the vaccines, and this vaccine, the COVID vaccine, it is going to come up in two stages. I mean, the one person will get two doses of the same vaccine, which will be separated by a few weeks apart, and there is a priority sector which includes doctor, nurses, sanitation workers, and people who are in a specific age group. These are the priority sectors. They will be receiving the vaccine first before the entire nation receives it. So what are the precautions that we need to take care of while administering this vaccine? That is one thing the article is discussing about. And at the same time, the article also focuses about what precautions do we need to take after a vaccine is administered to a person. There may be reactions. What can be done to control those reactions, to address those reactions? And at the same time, there is a hesitancy among people after the data is revealed regarding the symptoms, or you can say regarding the reactions that have been caused in people. So all this needs to be addressed when the vaccine is rolled out, when the COVID vaccine is rolled out. India has now has a firm date to roll out the biggest vaccination program in its history. Now, India has already been administering vaccine to children in the age group of 1 to 5 and sometimes even over 5. So we do have the infrastructure of giving vaccines to children, but this is the first time that a pan India vaccine would be given, and this is also for the first time when adults would also be included in the vaccination program. Prime Minister Narendra Modi has said that from January 16th, after the Makar Sankranti and the Pongal festivities, doctors, nurses, and sanitation workers who are part of the priority group would begin getting the vaccine. So these people, the vaccine process would be administered to these people since they are at the forefront of fighting this pandemic. India has approved two vaccines in the emergency use mode, that is Covishield by Serum Institute of India, Pune, and Covaxin by Bharat Biotech. So it's important that you know which are the two vaccines that India has rolled out. The first one is the Covishield, which is developed by the other Poonawalla Institute, the Serum Institute of India, and the next is the Covaxin that is developed by the Bharat Biotech. While it is still unclear who gets which vaccine, there are more doses of Covishield available. There are more doses of Covishield available than uh, at present than Covaxin, almost 5 is to 1. So if there are 5 vaccines of Covishield, it's only one that is of Covaxin which is available. And it could take a few more months before the 30 million prioritized gets one of their doses. So how much is the priority sector? The priority sector, which includes nurses, doctors, sanitation workers, and a segment of the population above 60 plus, they constitute 30 million of the population. others who are in the 50 plus age group and those with comorbidities will have to wait much longer, especially in a situation where vaccines such as those by Pfizer and Moderna are not made available for import by the private sector. So we need to understand some statistics out here, and that is 30 million people are categorized, have been grouped into the priority sector, and it is these people who would be receiving the vaccine in the first instance, and then the vaccine will be rolled out for the entire nation. But if 30 million people are to receive the vaccine, then 60 million vaccines would be required, and the same vaccine, if we are taking Covishield, then the same Covishield, 60 million doses of Covishield will be required. As I said earlier, one person will be given two doses, and the same applies for Covaxin and the other vaccines. In such a case, at present we do not have sufficient stock of to give two doses to the people. That's one concern that is being talked about here. The second concern is that India has so far not accepted to import vaccines which are made by Pfizer, the US company, and Moderna. These are the two other companies which are the vaccines of which have been permitted in other countries and not by India so far. However, the vaccination begins under a cloud. Now we are going to see what are the challenges that need to be addressed while giving this vaccine. Covaxin belongs to a league of vaccines that has been approved without establishing its efficacy, namely the extent to which the vaccine protects from COVID-19. Now, although the results of Covishield are available, the efficacy results of Covishield are available, similar results of Covaxin are not available, or there is a question mark on these results of Covaxin as to how much will it help in protecting against the COVID vaccine. There have been differences among scientists, such as on the best testing strategy, the treatment, the extent of infection, but none more divisive than on the approval of Covaxin. So, why is there a question mark on Covaxin, and why is it that the scientists are not assured of rolling out this particular vaccine? It's not only about how this vaccine was tested, not about the treatment it will cover, not about the extent of infection it would cover in a COVID patient, but also about there is a division among scientists about whether this vaccine should be approved at all or no for emergency use authorization. Several experts have made the case that declining rate of infections and low relative mortality meant that India was not in a dire state of emergency that required it to approve an untested vaccine when more clarity would have come by March. So this is very important. Why is India hurrying so much when we have two situations that are in favor of India, that is declining rate of COVID infections, and the second is low relative mortality. That means the number of death in a given period has reduced. Not only the infections have reduced, but the number of death, that is a low relative mortality, has also reduced. So in such a scenario, is it really necessary to administer untested vaccines to the citizens when the results of these vaccines would come by March? So that's the question the article is raising. Covaxin is best kept as a backup in the event of a sudden surge of cases till its efficacy data are available and acceptable. So what can be the solution? The solution can be that in case all of a sudden the number of cases of COVID increase in India, Covaxin can be just kept as a backup and it can be used in such a case. And by that time, its efficacy data will also be available. Also, reports have emerged of trials in Bhopal where volunteers were seemingly under the impression that they were getting a protective shot when some were likely getting a placebo. So, as you are aware that dry run was conducted in 4 states of India, and one of them was Bhopal. And in Bhopal, there were some people who were just getting the testing of this COVID vaccine, but they felt they were actually getting the main vaccine when they were not actually getting the main vaccine. So there was this error of the people who received the vaccine there, the placebo, you can say. They also complain of medication no medication, medical follow-up when some developed symptoms such as fever, body pain, and loss of appetite. So what are some of the symptoms that people are getting after this placebo was administered to them? It is fever, body pain, and loss of appetite. Now these symptoms have been spreading, and therefore the hesitancy rate has also increased. The vaccine may eventually prove protective, and the adverse symptoms reported seen as a part of the variety of human body's response. There are 28,500 volunteers after all. Now, the symptoms that may arise in people is going to differ from people to people, given that every body is going to react differently. And the people who have volunteered to go for this test vaccine are around 28,500. So everybody is going to react differently, and we have to take care of the adverse symptoms too. However, a vaccine that evokes distrust is self defeating. So, in the initial stage itself, if Covaxin is to be administered when there is so much doubt about its testing, its treatment, its infection, if there's so much doubt about it, then the question mark arises whether it should be administered to the people or no. With childhood immunization, India has proven that it has the infrastructural backbone to inculcate millions. As already mentioned, India has the infrastructure, the necessary infrastructure, along not only in terms of the physical infrastructure, in terms of building, but India also has the necessary staff, because we have been in the process of childhood immunization since long. The dry run to test the COVID management software have reportedly given authorities valuable feedback on perfecting the prospective rollout. Now, as all of you are aware, that the dry run was conducted in 4 states, and the COVID management platform that was used for conducting the dry run, wherein citizens were to register their names, the prior this app would help them to register. It would help them to a particular date, and a particular time was given. So with the COVID management, the entire dry run was conducted. So the authorities, the management, they are aware of how the actual vaccine is to be given out. However, this could be undone if people do not turn up, and worse, if the vaccine hesitancy rises. Now, this is very important. Two issues that are being discussed here. That is, first is people do not turn up. People will not turn up if they're afraid of their symptoms, the medical symptoms that that they may have, that a particular person may have, and if that is not being addressed, if this hesitancy arises in people, it will be very difficult to administer this vaccine. The pandemic gave India an opportunity to examine its dispensation of healthcare. This is again a very important statement, and you can have this one statement itself can you may be asked to write an essay over this. Why? Because the pandemic has exposed India's health infrastructure. The pandemic has also exposed India's percentage of GDP that is spent on research, on hospitals, and on vaccines, on drugs. So, this is very important that we look at this as an opportunity and take and address all the loopholes. Along with improving access, the government must seriously examine the conduct of vaccine trials and work hard to bolster public trust in it and monitor the vaccination process for adverse reactions. So the government is faced with a multifold challenges. First of which is the vaccine trials which are being conducted, they have to be done in a true manner. That is the first challenge. At the same time, after the trials have been conducted, the hesitancy has to be removed from the public. Only then the public is going to come and administer themselves for the vaccine. And the last challenge for the government would be to monitor the entire vaccination process, and more importantly is adverse reactions have to be addressed. Only then will the hesitancy issue fade away, and people will come up for getting vaccinated. This is the first article. Let's move on to the second article. The second article is called Felled by Fire. Felled means cut down, and this is an article that is about the Bhandara tragedy, we can say, that occurred at the Bhandara District General Hospital in Maharashtra, wherein 10 newborn children, or you can say infants, have lost their lives due to fire that broke out in the neonatal unit, and that was because of a fire breaking out due to the oxygen saturation levels and the mismanagement of the hospital staff, wherein they could not save the babies. So this article is about that. Although the incident has been narrated, but the article focuses more on what needs to be done so that in future such incidents and accidents do not occur. Let's start with the vocabulary. Inferno. Inferno is a noun which means a large fire that is dangerously out of control. And the second word is perfunctory, which is an adjective which means carried out without real interest or feeling. So these are the two words that we need to understand to in order to understand this article. Let's read the article. To avert another Bhandara like hospital inferno, government must address the underlying causes. So, to avert, it means to avoid. As I said, this article focuses more on what precautions need to be taken so that such accidents do not repeat themselves. The deadly fire that snuffed out the lives of 10 infants in Bhandara District General Hospital in Maharashtra is a shocking reminder that safety norms in several medical facilities in India do not pass muster. This is a very important statement that although the accident has occurred in Bhandara District General Hospital, but such accidents, such medical tragedies have occurred in many other parts of the country also, and this is a reason to mention that proper care is not taken during the fire audit. You can say fire audits are not conducted, or some loopholes are there in its management, because of which some things are escaped. The parents of the babies who perished in the sick newborn unit have been plunged into a lifetime of trauma. So the parents have lost a major, you can say, a major it is a major loss for these parents. Some of the victims, a few days old, had been brought to the hospital for better care from smaller health facilities. Seven had a providential escape. It is actually ironical that from other smaller facilities they were brought into this Bandara District General Hospital, keeping in mind that probably this hospital would be able to provide them better facilities, but on the contrary, they actually lost their lives, and seven children or seven infants were able to save. The hospital staff was able to save seven infants from the 17 that were there in the neonatal intensive unit. There are reports of poorly trained staff failing to respond adequately. Now, this is one important statement the article is making, that the staff, what was the role of the staff? It is to try to stop the fire and save the lives of the babies, but there's a question mark on the training of the staff and the staff's not responding to the fire. The terrible blaze joins a long list of such accidents recorded in government and private hospitals, underscoring a painful reality. Safety protocols are yet to be institutionalized even in places where people legitimately expect a high degree of professionalism. So, this is very important. In a hospital, it is expected that there has to be institutional breakup, institutionalization of safety norms, of safety protocols. But it is found that in a place like a hospital where people expect lives are to be saved, on the contrary, it is this hospital which has taken away the lives of these infants. So, this is a very big question mark that is arising on the medical facilities of these hospitals. Last year, there were devastating fires in COVID facilities in Vijayawada and Ahmedabad, with several casualties that were blamed on poor oversight by fire authorities or faulty electrical repairs. Now, all of you must be aware of the Vijayawada incident that took place last year, where a hotel was used as a COVID hospital and fire broke out, killing 9 people. A similar incident took place in an Ahmedabad hospital, wherein because of the oxygen supply pipe, a fire started and 10 people lost their lives in a hospital where 31 COVID patients were being treated. So these two incidents point out to the fact that faulty electrical repairs and oversight by the fire authorities, both these need to be looked into. The Maharashtra government has ordered a probe into the Bhandara fire to be conducted in 3 days and a fire audit of the hospital but a perfunctory inquiry cannot effectively address the underlying issues. Now we need to understand this, that the Maharashtra government has ordered an probe into the Bhandara fire incident as to understand why exactly the fire broke out and what is the cause of these infants, these 10 infants that have lost their lives. At the same time, a fire audit of the hospital is also going to be conducted. What is a fire audit? A fire audit is an examination of the premises and relevant documents so as to understand how the premises are being managed regarding fire safety norms. So that is a fire audit which is going to be conducted in the hospital, in the Bhandara hospital, so that we can understand whether fire equipment was adequately present there and to extinguish this fire. Hospital fires are a distinct entity, and research indicates that there are specific factors that trigger them off and aggravate their impact. So, research is showing that because of levels saturation of oxygen levels in the hospital, in the neonatal intensive care unit, it is natural for fire to break out, considering all the electric equipment and the plastic that is present in the intensive care units. But what needs to be taken care of is how at best a fire can be managed if even if it has to break out. Intensive care units, neonatal ICUs, and operating rooms are often the sites of fires, implicating the presence of a high concentration of oxygen in a confined space. So, what is the reason for oxygen? I'm sorry. What is the reason for a fire breaking out in intensive care units, neonatal ICUs? Is because of the high level of oxygen that is present here. A review of Indian hospital fires published in the Journal of Clinical Anesthesia identified higher oxygen availability in intensive care facilities as the likely primary cause, with motors and electrical units in the room providing the ignition and plastics fueling it. So it's not one reason that is responsible for fire breaking outs in the ICUs or neonatal ICUs. One of the major reasons is higher concentration of oxygen levels. Apart from that, it is also the electrical units which are present there, the motors. Added to it is the plastics which are there. It is worth considering, therefore, whether hospitals have been audited with such factors in mind and to evaluate national building safety codes against international practice. So, whenever a new hospital is being considered for establishment, these factors have to be kept in mind, and at the same time, the building safety protocols have to be, you can say, assessed against international practice. What is it that happens in other countries, and what are the best practices that we can inculcate in our hospitals? Oxygen monitors for hospital rooms to ensure that the ambient level is within safety norms, set at a maximum of 23.5% by the US National Fire Protection Association, could help avert an accident. So if the Indian hospitals follow this concentration of hospital that is given by the US National Fire Protection Association of keeping it to 23.5%, probably such fires can be averted. Locating electrical equipment for air conditioners with sparkling potential away from the oxygen saturated areas may also reduce the risk. As the health sector expands, it is essential that all new infrastructure conforms to the rigorous safety standards, a small premium to stop disasters such as the Bhandara carnage. So, with COVID in the background, already the Indian health sector has been, the loopholes of the Indian health sector have been exposed. And with such a tragedy such as the Bhandara, such as the Bhandara tragedy, we really need to pay attention to our health sector. If the government sets the bar high enough, ensuring full adherence to safety in its buildings, regulatory authorities can compel commercial structures to fall in line. So, if such tragedies are to be averted, are to be stopped, are to be avoided, it is necessary, it is mandatory that all the regulatory authorities have to put all the commercial structures in line. The center should also create a public platform for insights gained from inquiries into hospitals' fires to be shared. Hospitals should mandatorily hold regular safety and evacuation drills, which are key to saving lives when a disaster strikes. So disaster by definition itself means something that happens all of a sudden. It's an emergency. So in such a case, what is important is that every hospital should have evacuation drills and regular safety drills, so that in case of an if in case of an unexpected emergency, people should know how lives have to be saved, because hospitals or medical facilities is meant for that purpose of saving lives. So hospital authorities need to take care of this. Thank you. That is about this article.